Yay! I know we said this last year. This is now a success story because when Eric Bruns and I co-hosted this at SimLearn, the National Simulation Center in Orlando, Florida in 2022, we declared it an annual event that year without having any indication that we would actually do it annually. So excited to see so many of you that were there with us even that first year, and also so excited to see so many new faces. I appreciate that you guys found it. I got so many text messages, emails, calls. Union Station? Aren't you guys impressed with this space? Yeah. Full credit to the event team for doing a phenomenal job of researching, finding, and then making it absolutely beautiful. Special thank you as well to our exhibitors. One thing that is true for these exhibitors out here, one, they are the ones who enable the heads and headsets experience that in so many ways defines this event. Also, what is true is that each of these exhibitors is present in at least one VA medical center, and many of them in more. So they are already partnering with VA, collaborating with VA, seeing impact at the direct patient level, at the staff level. So please spend time during those breaks, during your lunchtime, if you will, during the break time. Go put your heads in some headsets, talk to these people as we continue to figure out what this looks like as we define a new reality in healthcare together. This is an incredibly exciting time. We'll give you some more specific updates, but one of the things I do want to explain, we've gotten some questions about the dog. Did you guys see the dog on the background? Yeah. So if you looked closely, the dog's white coat said Rose Bailey PharmD. If you know me, you know that I'm a pharmacist. And if you know me very well, you know that I have a black lab named Rose. And so the story of Rose the PharmD is absolutely for your pure enjoyment. In October of 2023, under the guidance of the Office of Healthcare Innovation and Learning and with the support of Discovery Education and Affiliate Networks, DEAN, that's run by Dr. Carolyn Clancy, who will be speaking tomorrow, Dr. Susan Kirsch, who's with us today, and also will be speaking tomorrow, we stood up the Strategic Initiatives Lab, or the Strat Lab. The Strat Lab is designed to take on early innovation, disruptive innovation, that has a high likelihood of failure or that people find too risky, but should it prove successful, could transform how we think about healthcare delivery and experience. The concept of the Strat Lab came from what we're seeing happen with immersive technology. Over the past 7 years, the number of times we've been told we were crazy. No, I mean, can you believe healthcare and virtual reality? Like, how do those things work together? And yet here we are, right? So the Strat Lab exists to continue to look for other types of technologies, disruptive opportunities, and continue to see those grow. And I'll tell you a little bit about more what's happened with the Strat Lab over the past several months. For now, I would love to introduce you to more of the VA Immersive team. Asking Caitlin Rollins and Evan Davis if you guys would join me up here on the stage. That'd be wonderful. Thank you. If you guys have any questions over the next couple of days, I'm going to volunteer any of the three of us to help support you with that. If you've known the story of VA Immersive over the last 7 years, Caitlin and I started this together in 2017 at the VA in Asheville, North Carolina. And about 3 years ago, had the opportunity to add Evan to the team in leading engagement. Evan's done a phenomenal job and completed thousands of demos in events like this, at veteran service organizations and medical centers. And Caitlin has really built the backbone of the program itself, making it easier to order, make it easier to document. Some of the things that are less sexy about innovation, but if those things don't happen, neither does innovation. So I want to say thank you to this team. None of this work happens without these two, and we're here to help and support any of the questions that you have, whether it be about what we're doing now or where we're going in the future. And with that, we've continued to grow, so I'd like to ask Jared and Billy to join us on stage as well. Yeah, come on, I know. We're about to run out of room. I will tell you, we never envisioned that we would get to have this many people on our team, so super exciting. Jared and Billy are actively practicing clinicians in medical centers who are also joining in us with the work. So this is really critical that we highlight, emphasize, prioritize their voice, because they know the day-to-day challenges that many of you in this room also experience. That informs the design of the work that we do. It also means that we get to elevate and amplify the stories of many of you at Frontline Medical Centers alongside Jared and Billy. We also continue to define what implementation looks like and how do we do that. And then Billy's going to join. Billy, I don't even know if the paperwork is signed yet. I mean, Billy is so new with us. Like, this is really his first thing. We're throwing him in pretty deep. Yeah. But the real reality is Billy's been doing this, as has Jared, sort of as other duties as assigned for years at this point. He's just been sort of making it happen, so we're excited that we get to have him join us. He's going to be leading a lot of the research and more rigorous evaluation of many of our efforts. Now I'm going to add two more people, Amber and Anu, if you could join us on stage as well. Now, anybody you see on stage is happy to help, happy to answer questions. We are all part of the same team. Amber and Anu have joined us. Amber joined us in February as the project management lead. She has gone in deep and hard. We've got 24 different projects going on, and Amber has made it her business to try to make our lives easier by standardizing and creating some order around some of that work, which innovation, as we all know, is a little bit messy. Anu joined us a month ago. And so one of the things with Anu is her focus is going to be around data. I'll talk about that a little bit more, but excited to have her a part of the team. And now last but absolutely not least, Dr. Susan Kirsch, if you could join us on stage as well. Now, I can tell by the cheers that many of you have gotten to know Dr. Kirsch as well over the last 2 years. We met for the first time at the very first Immersive Summit in Orlando. It's our second anniversary, by the way. You gave me flowers. Jared, where are the flowers? Right here. See? Look, flowers. So Dr. Kirsch has been the executive sponsor of this work over the last 2 years and has really helped us drive this forward and up into the system. As you guys can imagine, VA is a large and complex organization, 9 million veterans, 400,000 staff, 172 medical centers, over 1,200 sites of care, and this is the entire team. And so without executive sponsorship and advocates who have been legacy and has done her entire career in VA, really knowing how to navigate that system and also having built really strong relationships across the organization and trust, we would have been dead in the water, no matter how good what this work is, no matter the impact. And so we thank you for that, Dr. Kirsch. All right, you guys can have a seat. I'll give you a few more specific updates, and then we'll get on to the reason that you guys showed up, and that was to hear other people talk. So I'll try to wind this down a little bit. We can go ahead to the updates. As I mentioned, I'm Ann Bailey. I'm a pharmacy practitioner by training. This is my real hair color. Lord is my middle name. Those are the things that most people want to know about us. Do I have a clicker? Oh, I do. I should know. These guys are so amazing. It's always all very much prepared. I was having a conversation with Joe Morgan. Joe, are you in here? He may be in heads and headsets. Okay. Joe's back here. So Joe and I were talking not too long ago. I've had many conversations with many of you, whether you're frontline staff, VA leaders, veterans, or some of our collaborators and partners in industry and academia who have been doing this for years, and many for decades. We stand on the shoulders of giants. This did not start with us 7 years ago. There was such a strong foundation laid. And Joe and Waya Health have been a part of this really since the beginning. And he and I were having a conversation about, over time, you start to get tired. Sometimes you start to wonder, is this really going to happen? Are we really going to see the transformational change in healthcare that we think we should see? And Joe sent me this message after our conversation: never underestimate the power of a small group of committed people to change the world. In fact, it's the only thing that ever has. And we are that small group of people. So thank you guys for joining in this mission and in this work. And we really do believe that this is changing the world. What we see happening at VA is being absolutely driven by our veterans who are asking for more. We have veterans who call the crisis line and say, where can I get a VR headset? We have veterans who say, I have not been without pain for 10 years, 15 years. This is the first time I wasn't experiencing pain. I haven't been able to connect with my loved ones, and this is the first time that I felt comfortable enough in my own skin to have these conversations. We hear and see veterans who say, I can walk because the VA has helped me, and one of the reasons I've wanted to keep showing up is because I get to do some of my therapy in VR. And so we know from the patient level, from a system level, from a staff level, we have to keep going. And the only way we can keep going is if we do that together. So thank you for being a part of this small group of committed people, because we are seeing the world change. We get calls from Israel and Ukraine and Germany and all these other countries, New England, the UK, New England too, but that's not, sorry guys from New England, you are not another country, regardless of what you think. Asking how VA has done what they've done, and it's because of so many of you. So I know last year we said at the end, I want to take a moment to pause and say, thank you for the way you engage on the Whova app. Like the comms team that's here will tell you, I'm terrible at that. Like they ask me, should we do push notifications? Should we ask questions on Whova? And I think, nobody's gonna do that. But you guys do a phenomenal job of connecting with each other and setting up meetup times and asking questions and networking, so thank you for engaging there. And last year when you engaged there, we asked a question. We said, where do you want us to focus over the next year? And if you'll recall, that was August of 2023. And so one of the things you said is increase access to headsets, keeping accessibility, equity, and inclusion as foundational. At that time, at the Immersive Summit last year, we had 1,200 headsets that were deployed across the VA system. We set an ambitious goal of saying 10,000 headsets, to which people reacted in two ways. They either told us we were crazy and we didn't know what we were talking about, or they got really excited and asked how they could help. We appreciate both. What we've actually seen happen over the last year is we've increased that number to 3,500, right? And that's an environment where I'll tell you our boss, the Chief Innovation Officer, who many of you know, Mark Zhang, calls this a brute force effort. What we want to see, and you'll hear a little bit more about this as the day goes as well, is this become an enterprise-wide approach where we make it easier, but in the meantime, we're going to keep driving. So what number will that look like in 2025? I don't know. It'll be bigger, and we're going to continue to learn and grow. Another thing that you'll hear more about at the end of the day today is Made for VA, an initiative we've launched to help address this exact challenge, accessibility, equity, and inclusion, as we think about the design of access to those headsets. Another thing we talked about was standardizing training and education for staff and patients, including in-home training for rural veterans. This is where Evan has been really driving a lot of the work with Caitlin supporting, thinking about how do we do more standardized training. We have XR 101 that we offer to 20 different clinical disciplines across the VA now. How do we take that to the next level? How do we offer in person? Also, how do we not just train our staff, but how do we train our veterans so that they can use it at home? This is where I'm going to give a shout out to Liz in Biloxi and the work that she's been doing there to really enable the process of making this more available in veterans' homes. You'll hear more about that later today as well. And then ensuring access to more and better data by focusing on interoperability. I mentioned we had the opportunity to hire Anu. She has been given the task of designing the strategy and vision around data. Our vision is certainly to take that data and then create what we hope looks a lot like a formulary. I mentioned I'm a pharmacist by training. We would love to see that kind of data inform how we are providing these to veterans. And I think something that's really important as well, this is where we're seeing more and more collaboration. Anu started a month ago, but there are other members across the team. Terry, are you here yet? I know he was coming. Terry's back here. He's been helping. Hugh, Andy Bartlett. There's several people, again, really emphasizing the value of doing this together as a community. So I've introduced you to the VA Immersive team, and what you'll see, what we've seen happen over the last several months is actually VA is starting to think beyond this as just innovation and more, how do we scale and sustain this technology, make it more available from an enterprise perspective. So what we're going to start to do, and you'll start to see happen, our roles and responsibilities shift into two specific teams. The Strategic Initiatives Lab has been moved into the new Digital Health Office. The VA Immersive team will now span 2 different offices, with part of that team focusing primarily, being led by Caitlin and focusing on the innovation piece so that we build a pipeline. So that what it looks like is, yes, we want to scale and sustain things that we know should just be normal and available, but also we don't want to miss rising and emerging opportunities. So Caitlin is going to lead the charge on the innovation side. Then Amber, Anu, and I are going to see if we can't tackle the scaling and sustaining challenge. One of the things we know is this team, while it's separated by boxes, will still work intricately together. We will have to. We will also continue to have to work across the entire organization. And potentially, most importantly, we will have to continue to work together with all of you, because some of these are great challenges. A month or so ago, I got to do the rim to rim to rim in the Grand Canyon. And in a lot of ways, going from innovation to scaling and sustaining of a relatively new technology in an organization as complex as VA feels a lot like crossing a canyon, right? Here, here. That's right. You can tell who's been trying to help us think through this, right? And so we know it's going to take us all together, coming from different levels of expertise, different backgrounds, both clinical, administrative, technical, information technology. Most importantly, keeping the veteran voice at the center. Because if we're solving problems that they are not articulating that they even have, or solving them in a way that doesn't resonate with how we need to solve those problems, then what are we doing, right? So we will continue to work together as a team across many of those organizations. You've heard us say over the past 7 years, so for now I just want to emphasize the growth and change that's happened over the last 3 since our first Immersive Summit. At that time, the VHA XR Network, which is a virtual community of people inside the VA, it's all based on a Teams page. It's where we share so many of the documentation and templates and guidances that Caitlin has largely led the creation of. Vendor guides, how do we make it easier for staff, definitions of terms. That has grown from, in 2022, just over 1,000 people, 2,000 last year when we came together, to now 2,700 frontline staff. So we continue to see that group grow. And what's really exciting is we don't need to answer all the questions anymore. There is growing expertise across the entire organization, and people are really starting to share that knowledge. We've continued to grow in innovation pilots. Next year, we hope to add to this scaled and sustained implementations. So what we have right now, we went from 8 pilots in 2022 to 24 now in 2024. We have several that are rising in development right now, but we're currently at 24. And then our communities of practice. This has really been critical for the growth of this technology across VA, because it allows other interested parties to come together, to problem solve, to share success stories and lessons learned. We started in 2022, we had 3 of those: a general community of practice, a mental health community of practice, and an employee well-being community of practice. And then staff continued to say, those are great, but can we also focus on? So now we also have a pain management community of practice and a physical rehabilitation community of practice. And you'll hear from some of those leaders over the next few days. In October, we had the opportunity to record a podcast with Dr. Ellen Hall, who may make an appearance at some point over the next 2 days. The Undersecretary for Health, our big boss. We had the opportunity to record a podcast with him, and most importantly, emphasize and highlight the voices and stories of these veterans you see here. Really encourage you to listen to that, because that is the type of thing that is driving the direction we're taking this program. And most of what we heard here was we want this more accessible in our homes, so we can do this when we need to, asynchronously, under the guidance of our clinical staff. So please take a listen. We also had the opportunity to publish what's happened over the last 7 years to really solidify VA's leadership in this space. In the New England Journal of Medicine Catalyst, we published this in March. Lots of lessons learned there, success stories, yeah. It took 7 years to create, 1 year to write, and then they decided to publish. So that was good. That was a painful year, is that what you... So we also now have a newsletter. Again, this is where I trust people who know a lot more than I do about how to communicate well. The comms team said we should do this. So now we have a quarterly newsletter. You're welcome to click on that and see the latest edition, but also sign up. It's only quarterly. I am like many of you and don't need more newsletters and emails. This is only quarterly, and we promise you'll look forward to it. So please join us there as well in the newsletter. These are a few more resources if you're interested in learning more. Many of you, again, have been with us even since day one in 2017. But for those of you, we don't always want to assume you know the whole story. So you can check out more information on the innovation.va.gov webpage. Also learn more about innovation in general across VA. Diffusion Marketplace is a great place to go and find out about best practices in VA. And there's a little immersive technology community where you can learn more about some of the frontline staff and what they're doing with immersive technology. And finally, probably my favorite is this playlist on YouTube, because this is where we archive our videos of our veterans and staff talking about why this technology matters to them. There's some really powerful stories there. So hope that you will check that out. If you have any questions, you have met the entire team this morning. Find us over the next 2 days. Ask us questions. We love to connect with you. Also, you can email us at vaimmersive@va.gov. We would love to continue to support. So thank you so much for being here. It's going to be a great 2 days.